human immunodeficiency virus post-exposure prophylaxis or PEP guidelines and best practices in 2024. Introduction. Post-exposure prophylaxis or PEP is a critical intervention for individuals who may have been exposed to HIV. Here I will explain essential insights into PEP, including guidelines and best practices to ensure effective prevention and management of HIV transmission. Understanding PEP. PEP involves taking antiretroviral medicines after potential exposure to HIV to prevent infection. It is most effective when started within 72 hours of exposure. Understanding the mechanism and timing of PEP is crucial for its success. Eligibility criteria. Eligibility criteria for PEP. It is not everyone is eligible for PEP. Individuals must have had a potential exposure to HIV and their treatment should be initiated within the appropriate time frame. Assessing risk factors and exposure history is essential for determining eligibility. Pep administration. It is based on National AIDS Control Organization treatment regimen. It includes medication include tenofovir 300 mg, lamivudine 300 mg, efavirenz 600 mg once daily. The PEP duration will be 28 days course. So once daily for 28 days. So if it is possible, a single pill containing all three contents will be recommended. Patients should be informed about the importance of adherence to the regimen and potential side effects. There is a chance of mild side effects for antiretrovirals. Close follow-up appointments are necessary to monitor the patient's health. PEP is most effective when started as soon as possible after possible HIV exposure, ideally within 24 hours and no later than 72 hours. Follow-up care also important. Regular follow-up is crucial for PEP patients. This includes HIV testing at the baseline, that is at the time of incident, then after 6 weeks, then 3 months and 6 months post-exposure. So total 4 HIV tests are required, that is at the within 72 hours of incident. Then next one, second one is after 6 weeks, then after 3 months, then fourth one is after 6 months. Monitoring for any side effect, any adverse effects of medication is also necessary to ensure patient safety. So that is about post-exposure prophylaxis of HIV. It is a vital tool in HIV prevention. Understanding the guidelines and best practices ensures its effective use. Ongoing education and support for healthcare providers and patients are essential to combat HIV transmission. So that's about this video. If you have any doubts, you can ask in comment section, or you can send your doubts to our mail ID, thenursepage@gmail.com. Our website is thenursepage.com, or you can follow us through our social media account by the handle thenursepage. Thank you.